Hello, my name is Kate Hedlund and I'm with Cook County Health. Thank you for joining us. If you need any help with an appointment or have a medical question, you can reach our health system at 312-864-0200. My guest tonight is Carol Reese, licensed social worker, violence prevention coordinator, and chaplain at Cook County Health. She is also co-director of Healing Hurt People Chicago. Welcome to the show, Carol.
Thank you. It's good to be here.
Tell us about the work you do at Cook County Health.
So Cook County Health System is where I've worked for the last 13 years, largely in the Department of Trauma, where we see people who are victims of all kinds of traumatic injuries, penetrating traumas, gunshot wounds and stab wounds, also people who are involved in car crashes, all kinds of accidents due to falls or sporting events. And I work with a team of folks both in the hospital and in the community to support people in their efforts to heal from their traumatic injuries. So in the inpatient unit in the hospital, we have myself, who I typically function as a chaplain when I'm there. We have a team of social workers, another licensed clinical social worker, as well as 2 social work interns and 2 chaplains who serve our patients and families as they come into the trauma unit to receive care. It's a pretty scary environment for folks when they come in. Most people are, if they're injured badly enough to be in a level 1 trauma center, there's a likelihood that they are at risk of losing life or limb. That's what the trauma professionals, how the trauma professionals talk about it. So people are injured pretty badly, and it's a pretty scary situation. So our team of social workers and chaplains really work to engage the patients and their families as they come into the hospital to receive their care, to provide support, to do some crisis intervention work and get patients and their families connected with each other, as well as help people kind of deal with the scary situations that they're encountering, both either because they've been injured or because someone they really care about has been injured.
Talk about the work you and Cook County Health are doing right now regarding gun violence initiatives.
So there are a number of things that the health system, that Cook County Health is doing. There are our efforts in the hospital proper, both in the trauma unit and around other parts of the hospital where people are being taken care of because they have a traumatic injury. So there's the psychological support services that we offer both in the hospital and after people are hospitalized. We provide people with education about their traumatic injury. A lot of people we take care of come back sometimes in days or weeks, complaining of all kinds of symptoms. They're mostly mental health symptoms, not necessarily physiological symptoms because of their injury. So, for example, over the weekend, last week, a young man came into the hospital because he was having a lot of anxiety and flashbacks because of his traumatic injury. He was shot in an incident in his community a few weeks ago. And that's actually fairly common, that people have these symptoms and they think they're losing their minds, because these kinds of experiences have never happened to them before. They experience sometimes being frightened to go out of their home, out into the community, into their neighborhoods. They're frightened to do things that they would normally be doing. So kind of the very first layer of work that we do with a lot of folks in the trauma unit, no matter how they're injured, is offer that crisis intervention and emotional support, and then talk with them about the things that they might be experiencing after they're released from the hospital. So we call that kind of generally psychoeducation, so that they leave the hospital with some kind of sense of what they might experience, and then some coping mechanisms to deal with the with the fallout of being injured in a big enough way to end up in a trauma unit. So that what we anticipate is that as that messaging gets back into the community, that there will be less stress and distress related to the injury. So it's kind of, I guess, a little counterintuitive to think that a mental health intervention would actually be a prevention kind of initiative, but it does work that way because some of the symptoms that people experience once they've had a traumatic injury are being kind of hyper aroused or hyper vigilant. So they're always on guard for the next thing that might happen to them. Probably about, I think in the 70% range of clients that we've worked with in our Healing Hurt People program, which I'll talk about in a little bit, talk about having the experience of being always on guard and waiting for the next thing to happen. One of the things that happens sometimes is then people react or overreact to a situation in their community, and then may be prompted or promoted to commit a violent act because they're afraid of something that might happen to them. So there's the inpatient part of the work that Cook County Health is doing, and then we also have an initiative that's based at Stroger Hospital and also works with a partner hospital in Hyde Park, the University of Chicago Medicine, to implement a Healing Hurt People program. And so in that program, we have people who are specifically looking for young people who are injured due to community violence. So that means that they've been injured by somebody they may know or may not know, but it's just kind of random violence in the neighborhood. It's not domestic violence or sexual assault or those kinds of things, but it's that kind of community violence that's rooted in the places where people live, not typically in their homes.
Why do you think it's so important that hospitals like Stroger and Cook County Health work with these patients after they leave?
Well, the whole goal of this program, and there's a lot of talk about violence prevention in Chicago because this is a very tough issue that we've been facing for quite some time, and even in the last few days, there's been a peak of violent injuries in the city. So this is a public health issue that we need to address because we are a public health institution. It's a public health issue that all hospitals and healthcare providers ought to be addressing, because it begins both in the community, and I believe, and I think we as healthcare providers believe that much of this violence can be prevented. The work that we do in our hospital and in trauma centers around the city is not typically prevention because someone's already been injured. So they come into the hospital system once they've experienced an injury already. And the reason for trauma providers specifically to be engaged in this work is that there's opportunity. There's a saying in trauma care that talks about the golden hour. If you can get the right intervention to the right people at the right time, you can save a life. And that's really what we're trying to do with the violence prevention work that we're doing. We've typically saved a life already, physically, and then our work is to continue with those folks as they leave the hospital and address really the plethora of issues that people have in their lives that may have contributed to the violence in the first place.
Talk a little bit more about Healing Hurt People Chicago.
Sure. Healing Hurt People Chicago is a hospital-based violence intervention program. It was developed in Philadelphia by partners who we work with on a regular basis. 3 physicians, Sandra Bloom, John Rich, and Ted Corbin, all physicians with experience working in urban settings and working with African American and other young men of color who come into emergency rooms and trauma centers with violent injuries. And one of the things that they began to discover is that the cycle of violence that many of the young people we care for are involved in was kind of deeply rooted and deeply seated often in their upbringing. So what I mean by that is that the event of a traumatic injury, a gunshot or a stab wound or a fight or an assault, may not have been the first trauma that these young people experienced. When we survey the young people we work with, the average number of exposures to community violence that they have is almost 8. So out of a list of 14 types of community violence that we ask about, these young people are experiencing probably 65 to 70% of those types of community violence. So it's in some ways no wonder that they're often in distress, emotionally, psychologically, physically, because of their exposure to violence. So the Healing Hurt People program was developed to actually respond to not just the violent injury that brought someone to a trauma center, but to the broad range of trauma exposure that folks have had that has an impact on physical, psychological, emotional, spiritual health. So that's the background for the program. And I can go on to tell you how it works if you want.
Yeah, let's hear it.
Okay. So we engage people in the hospital often as they are first admitted. That team of people, social workers and chaplains that I talked about earlier, are those folks who often initially engage them in the hospital. We have a member of our Healing Hurt People team whose job it really is to actually see those folks when they're in the hospital, or if for some reason we're not in the building whenever they come in, that she provides outreach and follow-up with them by phone or when they come back into the clinic for care. And at that point, we assess people for their eligibility to the program. And that really there are only 2 things that are required. One is that the patient have some sort of injury related to community violence. And the second thing is that they're under the age of 30. And the only reason that there's an age limit on the number on the folks we serve is just is it about resources? Because we see people who come in with violent injuries throughout the lifespan. And at some point, we have to sort of figure out how we can actually serve those folks. So once they're identified and eligible for the program, young people are assigned to a clinical social worker who their term that we use for them is a trauma intervention specialist. And they begin their work immediately, often while the patient is still in the hospital, and then follow them through their hospital stay and out into the community. So it's really intensive, long-term investment in folks. Our trauma intervention specialists intend to see people every week. Sometimes for an hour, 2.5 hours, an hour and a half at a time, addressing both the psychosocial and emotional needs that people have, as well as attending to many of the practical needs that folks have. For example, if someone is discharged from our care and has kind of long-term rehabilitation needs, for example, they have a spinal cord injury, our trauma intervention specialists will do things like accompany them to their physical therapy appointments, make sure they have a ride to and from if their family has issues with transportation. They'll often help families figure out how to get their home or their apartment handicap accessible. So get access to a ramp if they need stuff like that.
Go ahead.
Go ahead.
Why do you think these little things that you guys do are so important for these patients?
Well, one of the things that one of our staff, who's a trauma intervention specialist, has started talking about, and I agree with, if there's a psychologist called Abraham Maslow who talks about kind of a pyramid of needs that people have. So the very basic level of needs are for things like food and shelter and safety. And if people can't get those very basic needs met, then it's very difficult to focus on kind of higher level needs like emotional support or self-actualization, school, those kinds of things that help people envision a better future for themselves. So by focusing on these very, very basic needs, it both kind of cements the relationship between the trauma intervention specialist and the client and the family as a helpful person. It communicates that we take them and their needs seriously, and then it also helps free up their physical and emotional energy to do the work of healing that so often is necessary because of the impact of the trauma in their lives. But if somebody's worried about whether or not they're going to have a place to sleep at night or food on the table the next day, they may not be so concerned about the fact that they're having flashbacks and nightmares, and get the help for that as well. So the trauma intervention specialists really work on two levels, both the practical level of helping to meet people's needs where they are, assist families in getting access, like practical things to, like getting kids back in school, especially a young person who may have been kicked out of school at some point along the way because of acting out behavior, whatever. And so there's a lot of ground to cover to get young people back to where they need to be so that they can be on track to finish school and possibly even envision college or career and those kinds of things. And it's often an uphill struggle because of, I don't think it's any secret that in Chicago is a very segregated city, and that much of the violence that occurs, at least that we see in our hospitals where we serve both on the south side and the west side, that's where a lot of the violence occurs. So people are often leaving the hospital and then going back to a community, a neighborhood, and sometimes even the same house where the shooting may have occurred. So their distress continues on for weeks and months and years often.
So we're heading into the warmer months, which historically has brought up a lot of violence in Chicago, and with that a lot of national media attention. What do you think people don't understand about Chicago and its issues with violence?
Well, I think some of it is just what I was alluding to about where the violence occurs, and I think for most of us, it's a very or many of us who work in the environment, it's a very complex set of issues that kind of set many of the communities that where we work up for the kind of violence that is experienced. I don't believe, and no data anywhere supports the fact that people who live in African American communities are more violent. That's just, a crazy notion. But what's not crazy is that because of segregation and kind of the historic issues of slavery and structural violence in this country, that when you look at the communities where many of the patients we serve come from, they're schools that are underperforming. There are very few resources in some of the neighborhoods where some of the young people we serve live. There aren't grocery stores. They get food at the convenience store or whatever is closer to them. The transportation system is underfunctioning. They have very little access to health services, very little access to mental health services. The neighborhoods are impoverished. There's poor housing. The list goes on and on and on, I think, of the factors that feed into that. And so I think for a number of the young people we work with, they believe that their lives don't matter to anyone else. And so when they're faced with all of these issues around, first and foremost, kind of self-worth and self-esteem, and, a neighborhood that looks like it ought to be not cared about, that poses a lot of difficulties for folks in viewing themselves in a way that supports nonviolent behavior. So there are all these kind of complex structural violence issues, along with ready access to guns. We have young people in our program who report starting carrying weapons as young as 10 or 11 years old. So when that's the way that you grow up, it's hard not to imagine that as the way one ought to live their lives. My colleague down at the University of Chicago, Dr. Brad Stahlback, talks about many of these young people as child soldiers. So they're in some ways conscripted into this way of life with access to weapons, etc., at a very young age before they have the ability to make these decisions for themselves. So I think there's a lot of work to undo all of this, the messaging, the facts of where resources in the city go, and what access to employment and all those kinds of things that people have in neighborhoods that are impacted by the violence that our city experiences. So I don't think it's necessarily about the weather, but I think when people are out and about and have access to each other, there's more opportunity for things to go badly or to go wrong.
What do you hope for this summer for the people that have been part of your program?
Oh, for the ones that are part of our program? Yeah. Well, I think the first thing that we hope for is that no one gets re-injured, no one gets killed. And that's my hope for all of us, in the city, that there's really a sense that they're valued. There's a saying within our Healing Hurt People program that the young adults and young adolescents learn as part of both our individual work and our support group work with folks, which is it's not what's wrong with you, it's what happened to you. So there's a very kind of early kind of integration of that idea that there's absolutely nothing wrong with you as a human being, and that my hope for the young people we work with is that they're whole and healthy and that they continue to be healed.
Thank you, Carol. Just a reminder that if you need help with patient care or setting up an appointment, you can call our Patient Support Center at 312-864-0200. Carol, thank you for joining us today.
You're welcome.